Recording in progress.
Because
Testing English channel.
the trying to see.
Test in English channel.
Oh, yeah.
Testing the English channel, testing technical check of the English channel. Good, coming through.
Testing, testing. This is the left console in the English booth. Testing.
Could I kindly ask everyone to please start taking their seats? We will begin shortly. Please bear with us a few more minutes as we get the live stream going. Un par de segunditos más. Thank you for your patience. I will start in Spanish. Muy buenas tardes.
Good afternoon. Welcome, everyone. I welcome the people here in the room, the people connected online, and I appreciate your being with us today. We're going to have this important parallel event to celebrate the Americas and the Americas' contribution to a sustainable WHO.
Good evening, everyone, and welcome to our high-level side event on WHO's investment round to celebrate the Americas' contributions to a sustainable WHO. My name is Luis Jimenez Maquinis, for those of you that I have not met. I am the Director of External Relations, Partnerships, and Resource Mobilization here at PAHO, WHO's Regional Office for the Americas. And I aim to guide you through today's proceedings. I know it's been a long day, and we want to get you very interested in the topic. Before I continue, I want to highlight that we have interpretation for all 4 official languages: English, Spanish, Portuguese, and French. So please ensure that you have your devices at the ready and as needed. And for those connected virtually, please be sure to choose the correct interpretation channel in Zoom or in our YouTube live stream. And thank you for those joining on screen as well. I also want to take this opportunity to announce and remind everyone that we will be hosting a light refreshment right outside once the event has concluded. So I truly hope that you will be able to join us, for those of us participating in person. And we have an ambitious agenda before us, so let us get to it. Today, we will strive to first showcase the pivotal role that countries in the Americas, along with key foundations, development partners, private sector entities, and other non-state actors, play in supporting WHO's mission to achieve health for all. Second, hope to provide a unique platform for our member states and WHO partners to showcase these contributions in advancing the global health agenda through both their strategic partnerships and voluntary contributions to WHO. Finally, we will have an array of interventions today from here in the room, virtually, as well as pre-recorded statements. Now, before we begin, I want to thank our leading panelists, co-chairs, and keynote speakers sitting here today. I will approach them as we introduce their turn to take the floor. So moving on to our welcoming and opening remarks. To help initiate today's event, we have a short message from Dr. Tedros, Director General of WHO. I hope the technology cooperates better with us today.
Delegation, dear Jarbas, my brother, dear colleagues and friends, this is an exciting time for WHO and for global health. At this year's World Health Assembly, WHO member states adopted the 14th General Program of Work, our comprehensive strategy for the next 4 years. We estimate that implementing this strategy could save at least 40 million lives by supporting you, our member states in the Americas and around the world, to promote, provide, and protect the health of your people. This includes scaling up primary health care, improving health emergencies capacities and addressing the root cause of disease, including the threat of climate change. GPW14 will also help to mitigate the severe inequities in health between countries and within societies, highlighted so dramatically by the COVID-19 pandemic. The new WHO investment round will enable us to mobilize the predictable and flexible resources needed to implement the GPW14 over the next 4 years. Working with existing donors and other partners, the investment round will include a series of events, including this one, to attract new sources of funding. The investment round will culminate at the G20 Leaders Summit, chaired by His Excellency President Lula da Silva of Brazil. The investment round is an opportunity for member states and non-state actors to come together in support of global health and WHO. All are encouraged to participate. Every pledge makes a difference, whatever the amount. Full, sustainable funding will enable WHO to better support your work to build healthier, more resilient, and more prosperous populations in each of your countries and as a region. I want to highlight especially the commitment, leadership, and contribution of the Americas in WHO's work and the remarkable results you have achieved. I thank the many stakeholders in the Americas for their financial contributions over the years, which have been instrumental in achieving those results. I urge you all not only to support the investment round directly, according to your means, but also to advocate with others to take part. Because in the end, this is your WHO. I thank you.
40 million lives, a very worthy cause and goal. We very much thank Dr. Tedros for his welcoming and inspirational words. Now it is my pleasure to hand over the floor to our Regional Director for the Americas, Dr. Jarbas Barbosa.
Thank you, Luis. Good afternoon. Honorable Ambassador Alexandre Gislene from Brazil, Honorable Ambassador Stuart Savage from Canada, Dr. Atul Gawande, Assistant Administrator for Global Health, the United States Agency for International Development, USAID, Mr. Daniel Thornton, Director of Coordinated Resource Mobilization, representing the World Health Organization, Honorable Ministers, distinguished representatives from PAHO's member states, esteemed partners from the private sector, foundations, and other non-state actors present in the room or connected virtually. Ladies and gentlemen, it is an honor to be here with you today. I want to start by recognizing my dear brother, Dr. Tedros, WHO Director General. Although he is not able to join us today, we greatly appreciate his perspectives on this very important event, particularly his gratitude and acknowledgement to all the stakeholders and partners in the region of the Americas for their invaluable contributions to WTO. I am truly grateful for this opportunity to celebrate the Americas' contributions to a sustainable and resilient WTO. As a regional director for the Americas, I am proud of our region's unwavering commitment to global health. This event underscores the pivotal role that countries, partners, foundations, private sector, and other non-state actors in the Americas have played in supporting WTO mission of health for all. The member states of the Americas have consistently demonstrated the leadership in advancing global health. From pandemic response efforts to combating non-communicable diseases, the Americas have contributed not only financially, but also through groundbreaking research, policy development, and technical innovation. Our region has been the protagonist of many landmark achievements that have greatly contributed to global health, such as being the first region to eliminate polio in the early 90s, followed by rubella, congenital rubella, and neonatal tetanus. Today, several other communicable diseases are not far from elimination. Decreasing the child mortality rates as a result of the advances implementing effective measures on health promotion, prenatal care, and maternal health, nutrition, vaccinations, and water and sanitation. And innovating by creating regional pool procurement mechanisms, the revolving fund for access to vaccines, and the strategic fund for essential medicines and public health supplies. Both ensure lower prices for governments and better access to our population in the countries in the Americas. These achievements, just to name a few, embody the importance of investing in health. We know, as a result of the COVID-19 pandemic, that health is a major driver of sustainable development, and funding for health is not an expenditure, but a smart investment. Allow me to switch to Spanish. Como han visto y experimentado.
As you have seen and experienced, although the region of the Americas has made major progress, there are still significant health disparities that need to be addressed. We all know that health advances can be fragile. That's a reality that we all experienced during the pandemic. This brings me to the importance of our partners and the importance of the member states attending this meeting. I would like to seize this opportunity to highlight the contributions of this region's member states to WHO throughout its history. While assessed contributions are an essential source of funding, we must recognize that voluntary contributions to WHO are key to securing the total financing required to achieve all of the objectives we have set for ourselves. It is through the support of contributors, such as the actors present here today, that we can continue to move towards our goal of saving lives under WHO's 14th General Program of Work that was recently approved in the World Health Assembly by member states. The countries of this region have been tireless defenders of the importance of the global health agenda, and they have invested in WHO for a safer and healthier world. Therefore, we are gathered today to celebrate the historical, current, and future contributions of the region of the Americas aimed at positioning health at the center of the global agenda. Today, we will have the opportunity to hear from some of our member states that have been strong contributors to WHO and hear firsthand about their own experiences. Likewise, colleagues will be sharing their outstanding examples of how their partnerships with WHO have had a significant impact on global health. This is true when we look at traditional partners and leading institutions such as the Gates Foundation, the Clinton Health Initiative, and the CDC Foundation. Innovative and solution-oriented organizations like Rotary International, St. Jude Children's Hospital, and MSD from others. and champions in the field of development and transformation of research into action, like the World Bank, the International Development Research Center, the Carter Center, and Johns Hopkins University. This is how we envision achieving WHO's founding vision of the highest level of health possible for all people through a predictable, flexible, sustainable, and resilient framework with the support from all actors. We would like to invite you to continue to support WHO. Your contributions have been essential, and as we move forward, I encourage you to remain committed to our shared mission. Together, through the WHO investment round, we can build stronger and more resilient health systems in the Americas and around the world. Let us seize this moment to reaffirm our commitment and ensure a healthier and more equitable future for all. And to conclude, allow me to speak Portuguese. In this positive spirit, I want to thank Ambassador Ghisleni for being with us and for being our keynote speaker. We will be hearing from the representative of the government of Brazil during its presidency of G20, and also will be supporting the mission of WHO. So these are important events that will soon be held in Rio de Janeiro in the upcoming days. And I want to thank Brazil and the government of Brazil through the ambassador for his willingness to work with WHO right from the start. And I thank him for organizing this WHO investment round, and that will be part of the upcoming meeting of the G20 to be held in his country. So on behalf of the regional office of WHO for the Americas, here from the Pan American Health Organization, we express our appreciation for this effort on the part of Brazil. So the success of this investment round will be a success for all of us. Thank you. Thank you.
I'll agree that the countries of the Americas have been tireless advocates towards the pursuit of health, not only in our region, but on the global agenda. Now, to move to the next champion that demonstrates this type of leadership, not only in our region, but also globally, is Brazil. And we now have the privilege of hearing from our keynote speaker today, Ambassador Ghisleni, who is the Sherpa of Brazil in the G20 Health Working Group. So, Ambassador Ghisleni, you have the floor.
Thank you very much, and good afternoon, everyone. I'm very happy to bring to you the message of the Health Minister of Brazil, Nízia Trindade, who had to step out. Now we are here to strengthen, and we're happy to strengthen the support given to WHO in its mission to ensure that everyone has the highest level of physical and mental health. Within a global context in which historic challenges continue to undermine the right to health of our populations, there are new problems that arise in a very complex scenario, such as the impact of climate change on health, a humanitarian crisis, the risk of new pandemics, and other health emergencies, as well as the rise of the prevalence of non-communicable diseases, including those that are related to mental health. Now it's necessary more than ever for us to wager on multilateralism, cooperation, and solidarity internationally. And to this effect, I support Brazil's support to the central role of WHO in the architecture of global health, in the role that that organization plays of strengthening technical wherewithal of our national healthcare systems, even through its regional offices. We have the good fortune of having here in the region of the Americas PAHO as a vital partner for Brazil and the Ministry of Health of Brazil. Dear colleagues, it's with that outlook that Brazil took on the presidency or chairmanship of G20 under the helm of President Lula. We put global governance and the fight against hunger, poverty, social inequality at the center of the international debate, with equity at the heart of all of it. It can't be any different. In the case of health, the Alliance Against Poverty and Hunger was launched by President Lula. We've made important progress. The Ministry of Development for the reduction of inequality being a case in point. The Health Working Group is on its final stretch. This month, we will hopefully see many of you again in Rio for the Health Minister meeting. We seek throughout the year to promote interests and the specific needs of developing countries and of the most vulnerable populations. Ladies and gentlemen, this is why we are very enthusiastic in announcing that on October 31st, between 11:30 and 12:30 in the morning, on the side of the meeting of the Ministers of Health, there will be held a session about the WHO round of investment with limited participation by G20 countries and other guests. This event will be one of the pillars in the strategy to ensure the necessary financing for the central work of the World Health Organization during 2025 through 2028. At that session, we will hear presentations on the defense of financing WHO to answer any questions that partners may have, and they will come together to announce their commitments, pledge commitments to the central role played by WHO, such that we can ensure achieving the goals defined in the 14th Work Program 2025-2028. We have much to do to achieve the sustainable development goals by 2030 and to ensure universal access to health and universal health coverage for our populations. This is a crucial time for us to show collective resolve to tackle the challenges of global health, especially within a context of growing need for resources nationally as well as from abroad. The G20 plays a key role in this initiative, bringing together the largest economies of the world to promote cooperation in global health. The heads of state that will take part in the summit of leaders will have the opportunity to address this matter and to commit during their presentations during the session that will be devoted to the topic of international governance. That is slated for the afternoon of the 18th of November in Rio as well. Furthermore, there will be held a final session presided over by President Lula after the November 18th afternoon meeting. However, that date has not yet been defined, nor time, rather, has not been defined, in which Dr. Tedros, Director General of WHO, will have the opportunity to announce to the press and the international community what the final results of the whole investment round process that was kicked off in May. This session will take place at an undefined time, and that will be announced when the time comes. Brazil is committed to offer political support to the round of investment for WHO through our leadership as the holding the chair of the G20. We're going to drive forward the health agenda and inspire other countries to join this cause, contributing to the future that we hope will be a healthier and fairer one for all of us. Thank you. Thank you.
I can say that we are all inspired by the amazing work that you, Ambassador Ghisleni, and Brazil have put in to host the G20. Please count on our unwavering support, especially in these critical last months. Now we are going to hear from our valuable partners representing development institutions, the private sector, foundations, international financial institutions, international organizations, and non-state actors. We will begin with a recorded video statement. So on screen, we have Dr. Marcelo Haik, Advocacy Advisor of Rotary Foundation and member of the International Polio Plus Committee. He will also be speaking in Portuguese, so if you need interpretation, please be sure to access your device.
Rotary International is a leader in the initiative for the eradication of polio, known as the IPPC. We worked with WHO as soon as we defined the world free of polio in 1980. The World Health Organization has offered strategic guidance and technical support that is leading the world toward considerable strides we've achieved toward reducing the incidence of polio by 99.9%. And the 5 regions of the World Health Organization were certified as free of the wild polio version, and 20 million children and who otherwise would have been paralyzed now today are walking. The Americas was the first region in our collaboration where we had the first success. The last case of polio detected 3 years after the goal of eradication was defined. That certification of the eradication announced in 1994. Now, we should be proud of having achieved this for more than an entire generation. However, we can't rest on our laurels and assume that we have that status guaranteed. Now, after the pandemic of COVID-19 and the drop in surveillance and vaccination rates, that needs to be addressed for us to make sure that we continue free of polio. Now, we will continue to focus on interrupting the transmission of polio in endemic countries and in other regions. Our region of the Americas was a beacon of the initial success and sets an example for other regions. We will continue to keep up that tradition of excellence in public health. The volunteers of Rotary are proud to have established a partnership with the Pan American Health Organization and the World Health Organization to achieve that success, and we continue to be fully committed to follow through on our promise. Since 1985, we provide more than $1.4 million, have provided more than $1.4 billion to this work, in addition to the progress made toward eradicating polio. This investment helped us to set up an extraordinary workforce of professionals with incomparable experience, and we have been able to reach the most vulnerable children with the vaccine against the polio, as well as other vaccines, providing other essential healthcare services at the same time. We also helped to set up a global network of laboratories and a surveillance system that helps us to protect the world against outbreaks of polio and other infectious diseases. The experience and the knowledge about that we've gained from the eradication of polio has enabled us to do the same, avoiding outbreaks of Ebola, as well as to bring to bear a response to COVID-19, distributing vaccines, and also for surveillance of mpox. These value-added investments are the reason Rotary International continues to work and to invest rather in WHO. We are eager to continue this collaboration with the Pan American Health Organization as well as with the WHO so that we can achieve this shared goal of a world free of polio and thereby build a healthier world for all. Thank you very much for this opportunity.
I know that Dr. Haik would have liked to have joined us here today, so we very much appreciate this statement so that he could still participate and contribute to our event. Now we are moving back to the room, and it is my pleasure to introduce Dr. Juan Pablo Uribe, Global Director for Health, Nutrition, and Population at the World Bank, and the Director of the Global Financing Facility for Women, Children, and Adolescents, to provide his intervention. The floor is yours.
Muy buenas tardes.
Good afternoon.
Thanks to you all, and thanks to the Americas Regional Office of WHO for convening this important meeting. After participating in WHO's investment case launch in May in Geneva during the World Health Assembly, I'm really happy to be able to join this milestone meeting in DC representing the World Bank in celebrating the Americas' contributions to a sustainable, properly funded WHO. It is unacceptable that today, Billions of people lack access to essential health services and fall into poverty or are trapped in poverty because of the absence of financial protection mechanisms. It is just not right that out-of-pocket expenditures are still, in many countries, the prevalent financing mechanism for healthcare. It is also troublesome today, after the COVID shock, that countries don't have the means and capabilities to protect communities against health emergencies while at the same time maintaining the delivery of the essential services that those communities need. Universal health coverage is at the heart of resilient health systems. Failure to prioritize and invest in UHC will only lead to more lives risked, more poverty, and missed opportunities for economic growth. That is why our President Ajay Banga announced in April our aspiration to reach 1.5 billion people with quality, affordable health services by the end of 2030. We had the privilege of having DG Tedros, the Director General of WHO, with President Banga at the podium that morning in DC when this target was announced. This was not a coincidence. In advancing all our health priorities, we closely partner with WHO in so many ways, from coming together to co-lead the creation and functioning of the Pandemic Fund to publishing every other year the Global Monitoring Report on UHC, from working on climate and health to advancing sound nutrition policies. In middle and low-income countries, in fragile and conflict spaces, we bring together complementary efforts aligned with government's leadership to address the unfinished agenda of maternal, neonatal, and infant health, of rising concerns around mental health, of NCDs and infectious diseases, of reaching out to zero-dose children and bringing digital in health. In preparing and preventing for pandemics, and as is happening right now in responding to outbreaks. All of the above, together, almost on a daily basis at the global, regional, and country levels. This is particularly key for this region of the Americas, your region, also my region, a region where progress in UHC, in reducing health outcome disparities and tackling NCDs is as important as ever. And it's moving fast under your leadership, trying to force resilient health systems in the region. It is this type of partnership, one of trustworthy collaboration and cooperation, of complementarity of capacities, the one that we all need and that most will serve us in confronting public health challenges. WHO is an indispensable partner. Its technical expertise, its regulatory role, and its policy guidance and voice serve all of us. A fully funded, effective, and efficient WHO serves all of us. As I said back in May in Geneva, Daniel, health is an investment, and WHO is health. Muchas gracias.
Muchas gracias, Dr. Uribe. 1.5 billion with quality.
Thank you very much.
Let us now hear from Ms. Jacqueline Calia, Director for MSD for Mothers, who is joining us virtually. I see her on screen. The floor is yours.
Thank you. Muy buenas tardes. I will deliver my remarks in English. Thank you so much to the Pan American Health Organization and specifically to Dr. Jarvis Barbosa for inviting us to this important event. And thank you to all of the distinguished guests with us this evening. On behalf of MSD, we are honored to be here today to talk about our areas of collaboration with the WHO through MSD for Mothers. My name is Jacqueline Caglia, and I'm a director with MSD for Mothers, dialing in today from the United States. For more than 10 years, and with social investments totaling $650 million US, our company's global maternal health initiative, MSD for Mothers, has been helping to create a world where no woman has to die while giving life. We've been doing this by taking a holistic approach to addressing the many factors that impact maternal health, while also striving to leverage the private sector for public good to achieve our shared goals around maternal health and health for all. This year in particular, we were delighted to announce that through MSD for Mothers, we've achieved a significant milestone, having reached more than 30 million women in over 70 countries through more than 200 programs that promote safe, high quality, equitable, and respectful care around pregnancy and childbirth. This impact has only been possible through cross-sector collaboration, working through public-private partnerships with governments, NGOs, professional associations, research institutions, other private sector partners, UN agencies, and for the focus of our time together today, with the WHO. We've been working alongside the WHO for more than a decade to improve maternal health and drive sustainable changes to policy and practice at the global, regional, and country levels. Whether it's been through advancing the world's clinical focus and available tools to address postpartum hemorrhage, preeclampsia, or sepsis in partnership with the Human Reproduction Program, or to supporting the efforts of WHO's Maternal Health Unit on strengthening national health systems to deliver high-quality care, expand their midwifery workforce, and bolster their approaches to maternal and perinatal death surveillance and response, or to path-breaking work on the WHO Country Connector, channeling private sector engagement in health with aligned focus and strong governance. We really truly value our longstanding partnership with the WHO as we work towards our shared goals, promoting good health and equitable access to health around pregnancy and childbirth. More recently, just this year, aligned with our approach of diversifying and expanding our collaborations with the world's premier multilateral organizations, we were delighted to sign a first-of-its-kind partnership with PAHO to respond to obstetric emergencies and unintended pregnancies in Latin America, with a particular focus on work moving forward in both Honduras and Peru. Although these examples are not exhaustive, I hope that they demonstrate our company's strong and unwavering commitment to improving maternal health across the Americas and beyond in partnership with a strong WHO. We are really honored and humbled to be a partner and remain available and committed to continue contributing to our shared goal of ensuring that no woman has to die while giving life. Mil gracias.
Thank you so much, Ms. Kalia, for your intervention. Thank you for joining us virtually, and thank you for the partnership. We do look forward as our regional office to continue to work through more future opportunities going forward. Now we will turn back to our PAHO WHO member states, and for our next segment, we are very honored to have Dr. Atul Gawande, Assistant Administrator for Global Health for United States Agency for International Development. Dr. Gawande, the floor is yours.
Thank you. First of all, thank you, moderator. Thank you, Dr. Barbosa, for the invitation to be here today, and all honorable ministers and distinguished speakers. I speak on behalf of the United States in saying that we are extraordinarily proud to be a member state, to be a strong partner, and consistently one of the largest donors to WHO and to PAHO, alongside other global health efforts year after year and decade after decade. We need PAHO, and we need WHO for a healthier world. Dr. Barbosa, you outlined the contributions from polio to rubella. We've seen, I saw before I even came in my role leading global health at USAID, the centrality of PAHO in holding up a leading light to how we drive public health. In 2009, where I was leading WHO's work in safe surgery, we came to PAHO to be the launch region for the WHO Safe Surgery Checklist, which I was fortunate to be part of helping design and test. This checklist has rolled out now. It is the standard of care in operating rooms across the world, has cut deaths by more than 40% in operating rooms everywhere. The PAHO's contribution again and again and again has been around being the innovator in driving the most life-saving measures in public health across the lifespan and across our global health architecture. We see that WHO and PAHO's vital work is essential for governments to meet the ambitious targets of the SDGs and beyond. We all want the investment round to succeed to help ensure that WHO has more predictable and more sustainable funding for its critical work. WHO embodies our shared values and remains vitally important to the global struggle for health and well-being on an equitable basis for all. Just know, President Biden, Vice President Harris in the United States remains fully committed to WHO. In addition to being the largest contributor of assessed contributions to WHO and PAHO, we provide hundreds of millions of dollars a year in voluntary contributions to help ensure PAHO and WHO can continue their critical life-saving work in the Americas and globally. Funding to WHO and PAHO is just one part of our contributions to the global health ecosystem. It includes also our significant contributions to the UNFPA, UNAIDS, UNICEF, Gavi, the Global Fund, and the Pandemic Fund, in addition to our considerable contributions to fighting HIV, TB through the PEPFAR program and malaria through PMI, as well as our Global Health Bureau. I recently had a chance just a few weeks ago to see our bilateral health programs by visiting USAID's health program in Brazil. And we started in Manaus and then went onward to Brasilia. And it was truly remarkable seeing the primary healthcare systems from a family health unit for indigenous populations, all the way through in Amazonia, all the way through to level 3 hospitals dealing with resistant infections, to laboratories and a wildlife screening center where monitoring is being done for conditions such as avian influenza. And what we saw was our concrete opportunities to partner in reducing the development and spread of dangerously resistant pathogens by improving infection prevention control in health facilities, and to accelerate our understanding of emerging arbovirus strains that are filling hospitals and ICU beds in the region, such as not only dengue, but Oropouche disease, which we are now seeing making their way to many of our countries, including us. The knowledge and opportunity for innovation at the source makes the work of PAHO and the work of countries like Brazil indispensable. This was just one country in an incredibly diverse region with a range of health challenges and opportunities, and it was an important visit to put in perspective how essential the work in this region is. So with that, I just want to say PAHO has been a critical partner to us and an outstanding leader, including for something I mentioned at the top of my remarks, the America's Health Corps, which we launched in June 2022. America's Health Corps is scaling up capacity to train 500,000 public health, health science, and medical professionals throughout the region of the Americas within the next 4 years. In the first 2 years of this initiative, together with PAHO, we've trained nearly 263,000 health workers across 22 countries in the Latin America and Caribbean region. That includes a diverse workforce ranging from epidemiologists to community health workers to clinical staff on surveillance for outbreaks, community-level prevention, and HIV clinical management. We look forward to continuing to partner with WHO, PAHO, and all of you to work towards our shared global health objectives. Thank you for the opportunity to contribute to this conversation today.
Thank you very much, Dr. Gawande. We are very appreciative of your remarks, the words for PAHO and WHO, and for coming here to make your statement. You have become a frequent visitor to PAHO, and we hope you will continue to come despite your busy schedule, so thank you. Now we will now move to the second block of partners, and we have a video statement from a valuable partner to WHO. On screen, we have Dr. Judd Walson, the Robert Black E. Chair and Professor of International Health at the Johns Hopkins Bloomberg School of Public Health.
Good afternoon. Thank you to the many organizers and the many delegates here today for inviting me to participate in this important meeting. My name is Judd Walson. I'm the current Robert E. Black Chair of the Department of International Health and a Professor of International Health, Medicine, Infectious Disease, and Pediatrics at Johns Hopkins University in Maryland, the United States. I'm honored to have been invited to highlight a few of the many contributions of Johns Hopkins University, particularly those of the Bloomberg School of Public Health, that we have made in partnership with WHO and PAHO. Together, we have partnered to save lives and protect health on a global scale, and over many decades, we've seen measurable improvements in the health and well-being throughout the region. As the world's oldest and largest independent graduate school of public health, the Bloomberg School has played an essential role in training global health leadership for WHO and for its partners. Our school is ranked first among schools of public health, and the role of partnerships with WHO, PAHO, and others in achieving this success cannot be overstated. We have a long history of training global health leaders. Marcolino Candau was a graduate who served as WHO Director General from 1953 to 1973, and Ruth Rice Puffer, also a graduate, led PAHO's Inter-American Investigation of Mortality in the 1960s, which revolutionized the accuracy and collection of health data globally. Our dean from 1977 to 1990, D.A. Henderson, directed the global smallpox eradication program and helped start the expanded program on immunization. We have trained thousands of leaders in our department and our school, and we are proud of the many, many alumni who continue to make positive impacts in the region and throughout the world. In addition to training and education, we have contributed to a number of important efforts with PAHO and WHO since our founding in 1916. Latin America has been a central priority for the Bloomberg School throughout that time. From 1947 to 1975, 2 of our alumni led PAHO. Fred Soper championed vector control against malaria and yellow fever, while Abraham Horwitz advanced smallpox eradication and participated in the development of Chile's National Health Service. More recently, Carlos Castillo Salgada has spearheaded WHO PAHO initiatives to provide access to crucial health data for 49 countries and territories in the Americas and to improve the quality of vital statistics and health indicators worldwide. He developed Spanish language training programs at Johns Hopkins and Latin American universities that have trained thousands of epidemiologists. Since the inception of WHO, our faculty have advised WHO campaigns against tuberculosis, cholera, malaria, syphilis, and parasitic diseases. Our Dean, Lowell J. Reed, chaired the commissions that produced the International Classification of Diseases, endorsed by the First World Health Assembly. And the founding chair of our Department of International Health, Carl Taylor, was also the primary WHO consultant for the 1978 Declaration of Alma-Ata that confirmed the universal goal of health for all. Our department and our school continue to partner with colleagues in Geneva and in regional and country offices around the globe, including many ongoing efforts with PAHO. I will provide some examples of how our faculty continue to engage and have impact in the world. This is not a comprehensive list, but it serves to highlight a few areas where we continue to partner and look forward to supporting further efforts. Robert Black has been a longtime partner and advisor to WHO, UNICEF, and many other organizations, and continues to help shape efforts to reduce child mortality from malnutrition, diarrheal diseases, and upper respiratory infections. Sarah Bennett, our vice chair in our department, is currently co-chairing a PAHO World Bank Lancet Americas Commission on Primary Health Care and Resilience in the region. Robert Gilman has played a critical role in developing a 40-year collaboration with Cayetano, who together have developed a shared research and training platform in Peru. Through this effort, he, along with Hector Garcia and many others, have trained over 30 leaders and made significant advances in diagnostics, treatment, and control efforts for TB, neurocysticercosis, and important work in air pollution, lung disease, and asthma. Antonio Trujillo has been involved in the economic economic incentive-based strategy development to improve diabetes management and has led a policy advisory board to support the Colombian government in mitigating the impact of COVID-19. Ambrasi Edward has partnered with a number of colleagues in the region to develop the PAHO Health Systems Performance Assessment conceptual model and multidimensional PHC performance framework for the region of the Americas. Krishna Rao and Andres Vecino Ortiz have developed multiple models to forecast health expenditures in Latin American countries and strategies to reduce expenditure through modification of sugar consumption, alcohol, and smoking. Finally, I personally am a member of multiple advisorial and working groups with WHO, and most importantly and recently have been proud to work with WHO on a number of efforts to strengthen clinical trials capacity globally. I hope that this summary provides a glimpse into all that we have done, but more importantly, all that we still can achieve. Thank you all for the wonderful opportunity to share our experiences working with PAHO and with WHO. We consider these partnerships among our most beneficial, impactful, enriching, and valuable. Our missions are aligned completely, and we look forward to continue to engage with you and your colleagues in order to ensure that all the peoples of the Americas enjoy optimal health and contribute to the well-being of their families and communities. Thank you.
And now, turning back to the room, we have the privilege of hearing from Dr. Kashef Ijaz, Vice President for Health Programs at the Carter Center. The floor is yours.
First of all, thank you very much, moderator, and Dr. Jarvis for providing us with this opportunity to be here on this August forum. The Carter Center, as an international NGO, has a long history of partnership with the Ministries of Health in the Americas to eliminate infectious diseases, and we are also a non-state actor. Inspired by our founders, President Jimmy Carter and First Lady Rosalynn Carter, I'm grateful for the opportunity to highlight two of these efforts. The regional effort to eliminate onchocerciasis in the Americas and the binational effort to eliminate malaria and lymphatic filariasis from the island of Hispaniola. Launched in 1993 at the recommendation of PAHO, the Onchocerciasis Elimination Program for the Americas is a regional initiative of National Ministries of Health, WHO, and PAHO. As well as the Carter Center, Merck, and many other partners, which actually contributed and has been contributing to it. It has seen 4 of the 6 endemic countries in the region verified by WHO as having eliminated transmission of onchocerciasis. There has been strong national program support during this time period, over $75 million of investment since 1991, which was critical in countries that have eliminated onchocerciasis. These countries include Colombia, Ecuador, Mexico, and Guatemala in that order between 2013 and 2016, using health education and mass drug administration of Mectizan donated by Merck. President Carter took great pride in being there in person in 2013 when President Santos announced that Colombia was the first country in the world to obtain WHO validation of onchocerciasis elimination. We are at present at the last mile, or I would say a last kilometer, which is shorter than a mile, when you look at the onchocerciasis elimination in the Americas. We are actually dealing with a population of around 39,000 people in the Yanomami focus bordering Brazil and Venezuela. It is a tough region, but I know that if anyone can do it, this region can do it, because it has been a trendsetter as well as a trailblazer in elimination of onchocerciasis globally. And it has actually been the model which is being followed in lots of other countries and regions. 99% of the world's burden of disease remains in the African continent. And a recently announced initiative to target the first-time elimination of onchocerciasis across all of Africa is directly inspired by the success of elimination of onchocerciasis in the Americas. And this is the demonstration that has been done by the Ministries of Health, our partners in the region, and more importantly, PAHO, as well as our donor and partners, which includes USAID, which has been providing support and ongoing support, as well as donors and pharma partners as well. And this is what has made it possible. Now, turning to Hispaniola on the about 15 years ago, the Carters were packing their bags for Haiti and the Dominican Republic to meet with the ministers, local health workers, and heads of the state of both countries to advocate for elimination of two preventable diseases, which is malaria and lymphatic filariasis, from the Caribbean island. The Carter Center is proud to have contributed to a decrease of 83% in reported malaria cases on Hispaniola since then. Both Haiti and Dominican Republic have also achieved significant progress against lymphatic filariasis. The Dominican Republic has met epidemiological requirements for eliminating lymphatic filariasis as a public health problem and is expected to submit its dossier soon for WHO validation. In Haiti, 87% of the districts have stopped mass drug administration for lymphatic filariasis, and 45% have completed post-treatment surveillance. This has been achieved by forging partnerships around a common cause, something that President Carter built his legacy upon. The Carter Center remains steadfast in our commitment to disease elimination in the Americas, and I share the passion of our founders in continuing this work. I hope you will all join us to celebrate President Carter's 100th birthday today. Thank you very much.
Thank you very much, Dr. Ijaz, and a happy birthday indeed to Dr. Carter. I would say elimination is a word that this hall knows quite well, given the elimination initiative, so thank you. Now allow me to introduce Dr. Trevor Peter, Senior Director for Diagnostic Services from the Clinton Health Access Initiative. Dr. Peter, the floor is yours.
Thank you, moderator, and thank you, Dr. Jarvis, for the opportunity to present the work of the Clinton Health Access Initiative in partnership with PAHO. President Clinton, after he left office, started the Clinton Foundation in 2002. And so the Clinton Health Access Initiative, which is a subsidiary or development from that original foundation, has been operational for over 20 years and is now functioning in 38 countries around the world, including within the region of the Americas. I would like today to highlight two pivotal collaborations between CHAI, which is short for the Clinton Health Access Initiative, and PAHO and WHO. That is malaria elimination and the elimination of cervical cancer. The partnership between CHAI and PAHO in particular has been crucial because PAHO and WHO overall have set the agenda for these two elimination efforts. They provided technical guidance and elevated the importance of elimination with the national governments and brought together many stakeholders, key stakeholders, in a collaborative effort. Firstly, on malaria elimination. Over the past 10 years, since 2014, CHAI has partnered with PAHO and a set of regional agencies to support governments, in particular Guatemala and the Hispaniola Island, in enhancing malaria elimination efforts at national and subnational levels. Malaria is particularly challenging in this region. However, the opportunity is great because of 12 countries that have eliminated malaria, at least documented by the end of last year. 4 of them have come from this region. Through efforts that this initiative has undertaken, particularly around strengthening surveillance and expanding community health worker networks and expanding the use of testing within communities, this initiative has led to a number of achievements, including a 96% reduction in malaria cases in Escuintla, in Guatemala, since 2015, with an ambitious target to achieve 0 cases by the end of 2025. In addition, a 92% decrease in the malaria burden in Greater Santo Domingo in the Dominican Republic. Recently, on top of this, CHAI has launched a dengue program in partnership with PAHO. This is aimed at reducing the dengue burden through the use of innovative tools, such as Wolbachia, combined with market shaping for these interventions through demand financing and affordable supply, and technical support through training programs. We hope that this will lead to more cost-effective and scalable implementation of these new interventions. Secondly, I want to talk about cervical cancer and our work together with WHO and, of course, with PAHO in the region. Over the past 6 years, CHAI has partnered with the WHO in a global initiative to eliminate cervical cancer under the Global Strategy for Cervical Cancer Elimination, adopted by the World Health Assembly in 2020. This program that CHAI has conducted has operated across 11 countries in Central America and in El Salvador in particular, as well as in Africa and Asia, to support national and local governments in establishing a comprehensive program for cervical cancer screening and treatment for precancerous lesions. In particular, in El Salvador, this program included the donation of testing supplies and equipment. Overall, the program has been successful. Within the short space of time, it has helped to introduce screening, improve screening and treatment for over 529,000 women in particular, and helped to avert over 3,200 cases of cervical cancer and an estimated 2,200 deaths, as well as save governments in these countries over $3 million in invasive cervical cancer treatment costs. The program is also successful in reducing the costs of screening tests and novel treatments by 40 to 45%. These initiatives across malaria elimination, cervical cancer, have been part of a very important program of CHAI, and we are very happy and thank the collaboration of WHO and PAHO in the region for this partnership. Thank you.
Thank you very much, Dr. Peter. I would say, again, elimination is a word we like to hear in this hall, particularly when it comes to the elimination initiative in cervical cancer and malaria being two important elements. I would say we've heard on alignment and partnership, and we'll go on to the next segment given these interventions. Turning back to member states, we now have the privilege to hear from Ambassador Stuart Savage. He is the permanent representative of Canada to the OAS. Ambassador Savage, you have the floor.
Merci, Monsieur le Président. Dr.
Thank you very much, Director Barbosa, Your Excellencies, distinguished colleagues, special guests. Good afternoon. Canada is pleased to be celebrating with you the contributions made to the World Health Organization. Just like the organizers of this panel, Canada is sorry that we haven't had greater participation on the part of women, but an effort was made, and I understand the circumstances that have impacted the situation, because the voice of women is definitely key to deal with aspects pertaining to WHO and the work it does. Canada has supported the work of PAHO and appreciates its leadership in establishing standards and the technical support given to countries in the aspects related to health worldwide. Now, as a member in the Americas, Canada has been pleased to work closely with the Pan American Health Organization so as to thus advance health, including sexual and reproductive rights of women, including women in vulnerable positions in the Americas. As you know, PAHO plays a dual role as regional office of WHO, and this is something that we see in the inter-American system. So they are positioned to contribute to a worldwide discussion and share best practices at the regional level in cooperation with WHO. Working with WHO and PAHO, we have been able to come up with a list of critical efforts: neonatal and infant health, maternal health, also looking at economic emergencies. That was the case of COVID-19. And all of this work is always ongoing to strengthen healthcare systems and to improve access to medical treatment at the regional and worldwide level during the pandemic.
Financial contributors, including through new major investments announced recently. On the 20th of September, Canada announced $151 million in funding as the next step in our contribution to support the Global Polio Eradication Initiative. Over $90 million of that will be used and allocated to the WHO to help take us one step closer to ending polio forever. And last week at the UN General Assembly, my Minister of Foreign Affairs announced a $33 million contribution to the WHO's Human Reproduction Program, which will advance us towards achieving universal access to comprehensive sexual and reproductive health rights and services. This new funding builds on significant Canadian support to the WHO in recent years for the COVID-19 response, strengthening primary health care, and health security. In the Americas, we are pleased to work with PAHO on a range of recent projects worth $90 million to support strengthening healthcare systems, COVID-19 vaccine access and supply, as well as SRHR and neglected tropical diseases. As the world continues to face new and evolving health emergencies, Canada has been there to support the WHO and PAHO in their response efforts. This includes our recent $1 million announcement to support the WHO's Mpox response, and $11 million in contributions to the WHO's Contingency Fund for Emergencies, part of which allowed PAHO to respond to humanitarian needs in Haiti in 2023. Canada's commitment and collaboration, though, go much beyond our financing. Canada has contributed as a member of the WHO's Executive Board and served as an institutional lead on the recent MOPAN assessment of the WHO, reflecting our keen interest in ensuring that the WHO continues to be positioned to drive for impact and progress in the health sector. On a technical level, Canada is a member of the steering committee for the WHO's Global Outbreak Alert and Response Network, which aids in the response to hundreds of disease outbreaks around the world. In this hemisphere, Canada's technical collaboration has included working with PAHO to improve access to climate change and health assessment resources for health authorities and strengthening regulatory capacities for medicines and other health products. Canada hopes that all our technical and governance engagement contributes to the development of relevant data and evidence to support health targets, standards, and guidelines for the greatest positive global and regional impact. Canada encourages all WHO and PAHO member states and observers to invest along with us to achieve better health outcomes for the Americas and around the world. Canada remains committed to the WHO and PAHO, and we are committed to seeing its success grow in the future. Merci, gracias, obrigado. Thank you.
Merci, Monsieur l'Ambassadeur. Thank you for your presence this evening, and thank you for Canada's active role in PAHO WHO. I will now turn to some of our valuable partners and would go to another virtual intervention. And it is my pleasure to hand over the virtual floor to Dr. Carlos Rodriguez Galindo, the Executive Vice President of St. Jude Children's Hospital, who we have on screen. Dr. Rodriguez Galindo, you have the floor.
Yeah, thank you so much, and thank you, Dr. Barbosa, and to all the friends at PAHO for this opportunity. So, Dr. Barbosa and members and representatives of governments and organizations, good evening, buenas tardes, boa tarde, bonsoir. It is an honor for me to represent St. Jude Children's Research Hospital in this important event to show our strong support to WHO and to PAHO in the advancing of care and improving cures for children with cancer in the Americas and in the world. As you know, St. Jude Children's Research Hospital is a research and treatment center that is fully dedicated to the cure of children with cancer and other catastrophic conditions. And over the last 6 decades, we have witnessed major progress in our fight against childhood cancer. So today, survival rates for children with cancer are higher than 80% when access to multidisciplinary modern care is available. However, as we also know, every year more than 400,000 children are diagnosed with cancer around the world, and more than 80% of those children live in countries with limited resources where the chances of cure are very low. And in fact, today, despite all these advances, only 20% of children with cancer in the world survive their disease. So the St. Jude Global Program is committed to address these global disparities to ensure that every child with cancer will have access to quality care no matter where in the world they live. St. Jude Global works in partnership with medical institutions, foundations, governments, and global agencies to strengthen the health systems, to increase capacity and quality of care, and to reduce the workforce gaps. So the St. Jude Global Alliance is now the collective effort of more than 300 programs in more than 80 countries. But so we understand as well that addressing disparities in access to and the quality of care for children with catastrophic diseases requires a much more comprehensive systemic approach to health systems strengthening. And that led us to develop a very strong partnership with WHO, which culminated in 2018 with St. Jude being designated the first and only WHO collaborating center for childhood cancer. So St. Jude initially mobilized more than $15 million to work with WHO and global partners to develop and implement the Global Initiative for Childhood Cancer with the goal of achieving at least 60% survival rates for those children by 2030. The GICC, the Global Initiative, is currently being implemented in 77 countries with the technical and financial support of the WHO and St. Jude. And expanding from this engagement, WHO and St. Jude, in collaboration with UNICEF and specific collaboration of the PAHO Strategic Fund, we have created the global platform for access to childhood cancer medicine to facilitate uninterrupted access to essential quality medications for all children with cancer, and which in the first 5 years could benefit more than 120,000 children in low and middle income countries. So we'll be launching this initiative in early 2025 with the first 6 countries representing each of the WHO regions, but with a plan to scale it up to 50 countries within the first 5 years. And St. Jude is providing this initial financial support with a commitment of $200 million over the next 5 years. And in all these efforts, St. Jude has placed a very special focus in the Americas, where we have partnerships with more than 100 institutions in 19 countries, and where we have been working hand in hand with PAHO for the implementation of the Global Initiative for Childhood Cancer and the Global Platform for Access to Childhood Cancer Medicines. And because of this strength of this partnership, we are providing $20 million in dedicated support to PAHO and the PAHO Strategic Fund towards these initiatives. So St. Jude Children's Research Hospital and the St. Jude Global Program are fully committed to continuing this work. Desde el Hospital de St. Jude y el Programa de Medicina.
So on behalf of St. Jude's Hospital, we are fully committed to continue to do this work with the World Health Organization and the Pan American Health Organization to fight against global disparity, provide access to quality treatment for boys and girls, for adolescents, and thank you very much for this opportunity. Thank you very much, Dr. Rodriguez Galindo.
Count on St. Jude as a valued partner for WHO PAHO. Now let me bring the attention back to the room, and it is my privilege to have Dr. Analia Porras, Deputy Director of Health Product Access and Agencies from the Bill and Melinda Gates Foundation, who is here to share her intervention. The floor is yours.
Thank you, y buenas tardes a todos y a todas.
Good afternoon, everyone.
It's been a long-standing partner with the World Health Organization, and as such, it's a pleasure and an honor to speak to you on behalf of the Foundation today, and to celebrate the region's contributions to a sustainable WHO. We are happy to highlight the importance of WHO investment round for the impact we can bring by aligning behind WHO. We have an unprecedented opportunity to fast-track progress and improve health. Now is the time for the world to step forward, not back, and fully fund global health organizations such as WHO to do their life-saving work. We currently have one of the most robust pipelines for innovations in global health. We are witnessing extraordinary advances in diagnostic therapeutics, vaccines, and preventive tools. WHO has a critical role in ensuring that these innovations reach those that need them the most. Imagine what we can achieve in the next 20 years through continued partnership and support for WHO and others in the global health ecosystem. We can ensure healthy pregnancies, cut maternal mortality, and empower women. We can cut child death in half once again. We can end polio and the scourge of malaria. We can create a healthier, more prosperous world for generations to come. These are among the Gates Foundation priorities that we advance in partnership and alongside WHO. As funders, we are leaning in to explore ways to make our funding more flexible. One tool we use extensively today is to make multi-year funding commitments. I would invite other funders in the room and watching remotely to consider all the ways you could make your support for WHO more flexible as well. Importantly, we would like to celebrate the agreement by member states to increase assessed contributions to the WHO and its regions. Assessed contribution has an unmatched impact on the work that WHO leads. By investing in WHO, the work can seize this unprecedented moment in time to save more lives, build stronger and more equitable health systems, and protect all communities from diseases that knows no borders. And to end in Spanish, ahora es el momento.
This is a time to ensure that we have a World Health Organization with full financing and to mark the beginning of an era of prosperity for World Health. On behalf of the Foundation, thank you very much for inviting me and giving me the opportunity to speak to you. Thank you, Dr. Porras. This is your second home, so it's great to welcome you back.
To give the floor to Dr. Rachna Shandora, President of the Non-Infectious Disease Programs at the CDC Foundation. You have the floor.
Dr. Barbosa, esteemed ministers and colleagues, thank you for the opportunity to discuss the CDC Foundation's contributions to the World Health Organization's mission to achieve health for all. The CDC Foundation is an independent nonprofit that helps the U.S. Centers for Disease Control and Prevention and the global public health community save and improve lives by unleashing the power of collaboration to protect the health, safety, and security of people all over the world. Since 1995, the CDC Foundation has launched more than 1,400 programs addressing a variety of domestic and global health issues. Throughout our history, we have partnered with WHO across a number of health initiatives, including cholera, malaria, meningitis, and rotavirus surveillance, vaccine research and confidence, emergency response and preparedness, including COVID-19 and Ebola response, novel approaches to surveillance, and global tobacco control. While all of our partnerships with WHO are fruitful, my time is limited, and so I will focus on the CDC Foundation's incredibly productive 18-year global tobacco control partnership with WHO. In partnership with all 6 regions and WHO headquarters, we implemented a robust tobacco surveillance and control program in over 100 countries. WHO shares the CDC Foundation's aim to reduce the global burden of disease and death caused by tobacco, thus protecting current and future generations from the harmful health, social, environmental, and economic consequences of tobacco consumption and exposure. WHO has been an invaluable partner in ensuring effective country engagement, opening doors to country leaders, and providing global policy leadership. As part of the tobacco control collaboration, WHO supports countries in their efforts to implement provisions of the WHO Framework Convention on Tobacco Control. Since 2007, the CDC Foundation has contributed to the WHO's tobacco control efforts by providing funding and resources for regional surveillance officers in each of the WHO regions and funding for full and partial country implementation. We are committed to our partnership with WHO and will continue to support initiatives that improve the health and well-being of people all over the world. The Americas, all of you in this room, serve as a leader in the public health ecosystem, an important partner in the CDC Foundation's domestic and global health strategy. Specifically, PAHO serves as a leader in innovative surveillance, methodology, implementation, and public health communication, as exemplified by our many infectious disease collaborations and our public health surveillance collaborations. The CDC Foundation congratulates the countries of the Americas on their contributions to a sustainable and resilient WHO. Thank you.
Thank you very much, Dr. Shandora, for that recognition, and thank you very much for the partnership. And now for our last but definitely not least contribution from a WHO partner, one that has also played a vital role in the Americas. Please let us now turn our attention to the screens and hear from Dr. Corluka, Senior Program Specialist for Global Health at the International Development Research Center, IDRC.
Hello, my name is Adriana Corluka, and I am a Senior Program Specialist with Canada's International Development Research Center, IDRC. IDRC prioritizes investing in high-quality research and innovation in developing countries, in sharing knowledge for greater uptake and use, and in mobilizing alliances for impact. Specifically in the Global Health Program, our priorities are to reduce health inequalities in sexual, reproductive, and maternal health and other essential health services, as well as fostering equitable and responsive solutions for infectious diseases, outbreaks, and epidemics. Our work is always underscored with a focus on strengthening health systems and policies. With the World Health Organization, we share priorities around the areas of work in One Health, climate change and health, gender and equity, and pandemic preparedness and response. We also share a vision of fostering health equity, sustainability, and resilience in global health systems, especially in vulnerable populations and regions. Our alignment and support with the multilateral system harkens back to the early 1970s with our collaboration with PAHO. We've also worked with the WHO in strengthening equity through applied research capacity building in e-health, as well as in strengthening health systems through identifying the policy and regulatory factors that help or hinder efforts for non-state providers in contributing to strengthening health systems. We support WHO's clinical trial of Ebola vaccines in response to the 2022 Ebola outbreak in Uganda. And we are also currently supporting TDR in further understanding the impact of climate change in sub-Saharan Africa on people's vulnerability to diseases carried by mosquitoes, flies, and snails. We are also supporting strengthening research and health leadership in One Health. We believe in WHO as our chosen partner because of its global influence and reach, its shared commitment to health equity, its policy-making authority, its knowledge-sharing expertise, and our collaborative partnership. We recognize Brazil's excellent leadership and presidency in shepherding the G20 health track, and we also wish WHO much success in this investment round. Thank you very much.
All right, thank you very much to everyone. We have now heard from partners across the gamut, from development institutions, the private sector, foundations, international financial institutions, international organizations, and non-state actors. But to close this event, I would now like to invite my fellow WHO colleague, Mr. Daniel Thornton, Director for WHO's Coordinated Resource Mobilization, to share his closing remarks. You have the floor.
Thank you very much, Director, Excellencies, colleagues. Whenever I visit a new country, I like to read a bit of history about that country. So as I'm visiting Amro PAHO, I read a little of the history of this place. I think we've heard quite a lot already about disease elimination and the impressive work that's been done in this region from several of the speakers, including the director. Learning about the history is very easy when you have very accessible publications that show a timeline of the diseases that have been eliminated over the years by this region working together with PAHO and with WHO. And we can see, you know, successively over the years, diseases eliminated in many of the member states. We can see some of the diseases that have been eliminated across the whole region. And for some of those, of course, we're talking about global eradication. And that's where WHO and PAHO work seamlessly together. So we see the eradication of smallpox, and we've seen nearly the eradication of polio, as we were hearing from our colleagues earlier. And this is really a tribute to the solidarity that this region shows, what can be achieved when the member states work together. We heard yesterday in a briefing session about the pandemic accord and the way that the region has come together and developed a common position on this vital global instrument, and through that has advanced the global work. So PAHO reinforces what the world does, and the world reinforces what PAHO does. We see this also in the strategies that we are jointly working on. So, as has been mentioned already, and as the Director General mentioned at the beginning of this session, we have a new general program of work in WHO, and I believe PAHO is also working on a new strategy, and these reinforce each other. We've also seen in the course of the last couple of days how the member states hold each other to account in this region and do joint assessments, and that does seem incredibly important. And I think it's a way in which in Geneva we need to learn from what you do so that we can develop strong accountability mechanisms as well for the global strategy. We've heard from a wide range of partners today, and many of the partners that have spoken are global partners as well. And I think just as our strategies are your strategies, as our pandemic accord is your pandemic accord, so our partners are your partners. And I think we've also heard some common messages over the last couple of days about the importance to PAHO of flexible funding, and you've heard it also with respect to WHO. We can't provide global public goods on a sustainable basis unless we have flexible funding. Now, I know this region is a little different than other regions, and you know, my colleagues in Geneva, and certainly since I've arrived, have been trying to explain to me why this region is different, and of course that PAHO was established before WHO. I think I heard that quite a few times. And of course, part of the solidarity from the member states here is that you contribute directly to PAHO substantially, as well as to WHO. And we need to recognize that, of course, when we make any appeal to you to contribute to the WHO investment round. But we are, of course, appealing to you to contribute to the WHO investment round. You've heard, I think, that we are proceeding through a series of regional events. We had the first in Afro. We had 14 member states pledging at that event, including, you know, Niger as a low-income country pledged $2 million, together with some philanthropic partners that added up to $45 million. We've since had 3 more African member states pledge, and others have committed to do so. We're proceeding through a series of other regional events in EMRO and CRO and WIPRO. And as the ambassador was explaining earlier, we have some vital events coming up at the G20 for for those member states that are attending the G20, and we'll see the culmination of the investment round at the Leaders Summit, where the results of the investment round will be announced. I think we've heard today from the very wide range of work that we do together. We've heard about cancer, preventing cancer and treating cancer with children. We've heard about disease elimination. We heard from Atul about his experience of safe surgery checklist, which, based on the best evidence and science, and then amplified through PAHO and WHO. And that's the platform that WHO can provide for the best knowledge and the best science. We've heard, just to pull a few examples from Chai, about cervical cancer and that vital elimination strategy across the region. And thank you, Canada, for the financial contributions that you've made and the other partnership that you've shown with WHO and PAHO, and also for the research that we've heard from Canada. So overall, I just want to conclude by thanking PAHO colleagues for putting together this event. Thank you very much, Director, for supervising this event. And I'd like to now hand back to you as moderator.
Thank you very much. And with that, distinguished delegates, we are now coming to a close. We are very grateful for those of you that are here. We are very grateful to our speakers and our important partners to WHO, given that your participation was invaluable. I think it all palpably demonstrates the invaluable contribution of the Americas to a sustainable WHO. So with that, I wish you all a good night. We have refreshments outside, do not forget, and thank you very much.
You're watching this video because you care about health, because health for all is an investment, not a cost. Because we all need health. Societies, economies, families, each and every one of us. Which is why it's so clear that the World Health Organization, WHO, needs your support, so that over the next 4 years, together we can save 40 million additional lives. Thanks to a strong new strategy which all governments have created together, based on the latest science, which all governments will implement in their countries and communities, guided and coordinated by WHO. We are a uniquely representative organization. Our members are East, West, North, South, hot and cold, big and small. Our partners are diverse, each bringing important expertise to the table. If we have fully funded WHO's new strategy, by 2028, we will all be able to say, together we have created 10,000 climate and shock resilient health facilities, trained 3.2 million more health workers, and analyzed thousands of signals to identify, assess, and inform on 30 health threats per month, so outbreaks are identified within 7 days. But to implement the strategy, WHO needs to be appropriately and sustainably funded, with predictability and with enough flexibility. That's why in 2024, we're launching the investment round. We are grateful to all our supporters and encourage our funders to follow those who are already committing flexible and predictable funding. Investment in WHO yields healthy results, a prudent investment, and a moral imperative. It moves us closer to the vision of health for all. We need you, each of our member states and partners, to turn this vision into reality. All for health. Health for all.